The dysfunction changing is in and we touched the distal pulses. And the most characteristic feature is the migratory superficial lumbar phlebitis, and the patient complains the intermittent claudication and left pain, gangrene, and ulceration. Diagnosis include the first younger than 45 years old and heavy smoker. Second is the presence of distant extremity ischemia. Third is migrated superficial lumbar phlebitis. The fourth is impaired distal pulse. The fifth is no atherosclerotic risk factors. The sixth is imaging findings, diffuse occlusion of the distal extremity vessels. This is the MI. We can see the operator occlusion. This is the DSA, the femoral occlusion, femoral artery occlusion. And the treatment. One is general treatment. It must be should do absolute discontinuity of tobacco use and prevent trauma and small of chemical injury, avoidance of cold environment, drugs that lead to the vasoconstriction. The third is very important is exercise. Second is medication. Include the Chinese traditional medicine. The second is vasodilators, antiplatelet drugs, and anticoagulators. Third is antibiotics to treat infected ulcers. The treatment. The third is hypertension oxygen treatment. The fourth is surgical treatment, include first vascular reconstructive procedure and bypass grafting or arterial venous transport. The second is the more advanced method is autogenous stem cells transplantation. The third is lobar symplectomy. The fourth is amputation for the no healing ulcers and gangrenes. Differentiation of the ASO and the TLO is very important. To the ASO, the age is more than 45 years old. To the TLO, in the TLO, the age is younger than 45 years old. In ASO, the superficial lumbar phlebitis is no, but is very common in the TLO. Hypertension, coronary heart disease is very common in the ASO, but is uncommon in the TLO. In ASO, they involve the large and medium arteries, but in ATLO involves the small and medium-sized vessels. In ASO, changing of the other arteries is very common, but TLO is no. Calcification of the involving artery is very common in ASO, but is not in TLO. The arterial graph showed the extensive irregular stenosis and segmental occlusion in so, but the segmental occlusion and others are normal in the tail. The third disease is arterial embolism. Arterial embolism shows the acute arterial occlusion and acute limb ischemia. It is a palpitations related to the extremity viability. And the source of the embolus is mostly from a tumor in atrial fibrillation patients. Other than embolus, thrombosis or a combination of the two may produce the obstruction. Clinical manifestation, 5P, the pain, the paralysis, the pillar, heartlessness, the paresthesis. Examination and diagnosis include sudden onset of symptoms. The second is 5P. The third is decrease of skin temperature. The fourth is Doppler examination. The fifth is CTA or MRI. And the treatment is include immediately heparin anticoagulation. The second is rapid surgical operation. We use the vagus canal thromboembolicectomy. This is the vagus canal. This is embolus. This is thrombosis. The vagus canal. The third section is the venous disease. First is the verticus of low extremity. Verticus is very old and very common disease, and is female more than male. Verticus veins in the leg, great and small saphenous vein, include primary verticus and secondary verticus. Isolation in superficial veins is the primary vertices. And verticus due to the pathology of deep veins is the secondary verticus. This is the vertices. Etiology and pathophysiology. Prolonged standing leads to the increased hydrostatic pressures that can cause the chronic venous distension and secondary valvular incompetence and wear with the superficial venous system. If proximal junctional valves become incompetent, high pressure passes from the deep veins into the superficial vein, and the condition rapidly progresses to become irreversible. Clinical manifestation symptoms include the patient completed uncomfortable pain, bone cramping, muscles fatigue. Signs shows the dilated vessels, mild swelling, inflammatory dermatitis, recurrent or chronic cellulitis, superficial thrombophlebitis, pigmentation, ulceration. This is ulceration. Physical examination include Chandler-Berg test, PSAS test, PAS test. But the three tests but the test evaluation value is decreasing. Doppler is no traumatic and showed blood flow and the valve function of the deep vein. The vein graph is showed the deep vein flows. And this is the Schindler test. It shows the valve function of the saphenous vein and the communicator vein. This is the pressure test. It evaluates the valve function of communicated vein. This is the process test. It shows deep vein flows. This is the vein graphic, so we can see the valves and the blood flows. And the treatment include non-operative treatment, sclerosis therapy, and operation. And wearing the compressing stockings and keeping the legs elevated is the non-operative treatment. To the operation, there is vein ligation, stable evolution techniques, communicated vein ligation. This is a compressing stocking. This figure shows the stripping of the greater saphenous vein. Second is the deep venous thrombosis, means DVT. And DVT is the major cause of morbidity and mortality in hospitalized patients, particularly after surgery. And thrombosis in deep vein, and edema of the lower extremity. And this is the left leg is DVT. Etiology means the virtuous child include the first venous stasis due to the reduced blood flow. Endothelial trauma creates site for the clot formation. Third is hypercoagulability, increase the tendency to the clot. This slide is the formation of the DVT. This is normal blood flow. This is deep vein thrombosis. This is the embolus. Clinical manifestation include swelling or edema of the involved extremity. Second is tetanus. Third is hormone sign. The patient complete pain in the calf or popliteal region with examiners abrupt dorsiflexion of the patient's foot at the ankle, while the knee is flexed to 90 degrees. This is the DVT of the lateral. Complication of the DVT include pulmonary embolism. Second is chronic venous insufficiency. Third is venous ulcer. The last is chronic edema. And pulmonary embolism means PE. Signs of PE is include chest pain, hematemesis, dyspnea, apprehension, hypertension, cardiac arrest. The diagnosis of DVT include venous duplex scanning, the D-dimer test, and Van Grab. Management of DVT. First is the bed rest with the extremity elevated. The second is anticoagulation, include heparin, low molecular weight heparin, and warfarin. The third is thrombolytic therapy, urokinase, streptokinase, and TPA, and so on. The last is the inferior vena cava filters to trap the embolus. Preventive measures. The first is active or passive leg exercise. The second is the intermittent compression device. Third is compression stockings. The fourth is encourage walking at ASAP post-operation. The fifth is do not cross legs. The sixth is pharmacological prevention to reduce the hypercoagulability. The sixth is adequate hydration. The last is stop smoking. This is the Medicare filter. At first, the radiograph showed the inferior vena cava is fluorescent, and then implanted the filter. And the filter is checked the embolus. After 3 weeks post-operation, we can retrieve of the field. This is the field. It's 9. Thanks.